When most people hear the word cancer, their minds jump to familiar types: breast, lung, or skin cancer. But there's another common yet often overlooked cancer that quietly affects thousands of Americans each year: bladder cancer. Bladder cancer doesn't always make headlines. It doesn't get frequent mentions in media or casual conversations, yet it's among the most frequently diagnosed cancers in the United States, affecting over 80,000 Americans annually. And here's what's especially alarming: despite being common, it often remains undetected until the later stages. Why is bladder cancer often overlooked? One reason is its subtlety. Its early signs can easily be mistaken for ordinary urinary tract issues. Symptoms like slight discomfort during urination or occasional blood in urine can easily be dismissed or misunderstood. Many individuals assume these symptoms mean something minor, like a simple infection or irritation. They self-medicate or wait it out, and knowingly allowing the cancer to grow unchecked. This is the quiet threat of bladder cancer: its ability to hide behind minor, seemingly innocent symptoms. And that makes early detection both challenging and absolutely crucial. But here's the good news: when caught early, bladder cancer is not only highly treatable, it's often curable. Early detection dramatically improves your prognosis, reduces the invasiveness of treatments, and greatly increases your chance of a full recovery. In this video, we'll guide you through the most common early warning signs of bladder cancer that you should never ignore, why early detection matters more than you might realize, clear, simple explanations of how bladder cancer is diagnosed, effective treatments available when the disease is identified early, simple yet powerful lifestyle changes that can significantly reduce your risk. Most importantly, this video isn't meant to scare you, it's meant to empower you, because knowledge is your strongest tool against cancer. Recognizing these signs early, understanding your risks, and knowing exactly what to do next can literally save your life or the life of someone you care about. Remember, you don't have to be a doctor to spot the early signs of bladder cancer. You just need to know what to look for. You have the power to take control. You have the power to make a difference. Let's get started by discussing why early detection truly matters when it comes to bladder cancer and why you should never dismiss these subtle, yet critical signals your body sends. When we talk about bladder cancer, early detection isn't just beneficial, it's essential. Here's why. Increased chance of successful treatment. Early stage bladder cancer is typically confined to the inner lining of the bladder. At this point, doctors have numerous highly effective treatment options, such as minimally invasive surgeries or localized treatments, which often result in complete remission. In fact, when caught in its earliest stages, the 5-year survival rate for bladder cancer can exceed 90%. But as cancer progresses, it invades deeper layers of the bladder wall. Eventually, it can spread to surrounding organs, lymph nodes, or distant parts of the body, becoming far harder to treat effectively. At advanced stages, treatments become more aggressive, often requiring major surgery, chemotherapy, radiation therapy, or immunotherapy. Simply put, catching bladder cancer early makes the difference between a straightforward procedure with excellent outcomes and a difficult, life-altering battle. Less invasive procedures. In early-stage bladder cancer, a procedure called transurethral resection of bladder tumor (TURBT) is commonly used. It's minimally invasive, often performed as an outpatient procedure, and involves no external incisions. Patients usually recover quickly and return to their normal lives within days. In contrast, advanced bladder cancer might require a radical cystectomy, a complex surgery that removes the entire bladder and often surrounding organs. This procedure is much more invasive, carries greater risks, and significantly impacts the patient's quality of life. Reduced physical and emotional burden. Early detection isn't just about survival rates, it's also about preserving quality of life. Catching bladder cancer early can help you avoid treatments that significantly impact your physical, emotional, and financial well-being. Fewer treatments and shorter recovery times mean less disruption to your daily routine and family life. Patients diagnosed at later stages often face extended hospital stays, lengthy recovery periods, more severe side effects, and considerable financial strain. Early detection minimizes these impacts, ensuring you maintain control over your lifestyle, better long-term outcomes, and peace of mind. Early-stage bladder cancer has one of the highest success rates of treatment among cancers. When diagnosed early, you can have peace of mind knowing that the prognosis is excellent. Follow-up and surveillance become routine and manageable rather than daunting and overwhelming. Moreover, regular checkups after early detection allow doctors to closely monitor your bladder health, catching potential recurrence at the earliest, most treatable stage possible. Early detection saves lives. Finally, and most importantly, early detection truly saves lives. Thousands of individuals diagnosed with bladder cancer each year lead healthy, fulfilling lives because they recognized early symptoms and acted promptly. Your awareness today can lead to early action tomorrow. Remember, bladder cancer symptoms can be subtle. The signs can seem ordinary or minor, but ignoring them allows cancer to progress unnoticed. Early detection breaks that cycle, giving you the advantage in your health journey. In the next part of this video, we'll discuss exactly which early symptoms you need to look out for. Knowing these symptoms can empower you to act swiftly and confidently if they appear. Bladder cancer often announces itself quietly, through subtle symptoms that can easily be dismissed or confused with common issues like urinary tract infections, UTIs, or minor bladder irritation. Knowing these symptoms can literally mean the difference between early treatment and a challenging, late-stage battle. Here are the most common signs you should watch for. 1. Blood in the urine hematuria. This is by far the most common early sign of bladder cancer and also the easiest to overlook or dismiss. It might appear as a faint pink or orange tint in your urine, or in more noticeable cases, bright red blood. It often comes and goes, causing many to mistakenly think the problem resolved on its own. Important: even a single instance of blood in your urine is reason enough to see a doctor promptly. Even if it stops afterward, it doesn't always signal cancer, but it must be investigated. 2. Frequent urination. Feeling the need to urinate more often than usual is another subtle early warning sign. You may find yourself going to the bathroom multiple times an hour or waking frequently at night to urinate. Increased urinary frequency is common with other conditions like UTIs or prostate issues, but when persistent or unexplained, it warrants further investigation. 3. Pain or burning sensation during urination. Many patients describe an uncomfortable or painful burning sensation while urinating. This symptom is also common in infections, but if you don't have other infection symptoms like fever or cloudy urine, or if antibiotics don't help, further evaluation is needed. 4. Urgent need to urinate. A sudden, strong urge to urinate that feels impossible to ignore, even if your bladder isn't full. Urinary urgency without a known cause such as caffeine intake or anxiety can be a subtle sign of bladder irritation caused by cancer cells. 5. Weak urinary stream or difficulty starting urination. Experiencing a weaker than usual urinary stream, dribbling, or hesitancy in starting urination can indicate a blockage or narrowing due to tumor growth in or near the bladder. While this symptom is often associated with prostate enlargement in men, it can also be present in bladder cancer. 6. Lower back or pelvic pain. Persistent, dull, or nagging pain in your lower back or pelvic region can be another subtle clue. This discomfort often results from tumor growth pressing on nearby tissues or nerves. Pain associated with bladder cancer is generally constant or recurring, rather than sharp and fleeting. 7. Feeling a bladder fullness even after urinating. A sensation that your bladder hasn't completely emptied after urinating. Tumors can interfere with normal bladder function, causing incomplete emptying and residual urine to remain in the bladder. 8. Unexplained fatigue or weakness. Cancer cells draining your body's resources may cause chronic, unexplained tiredness or fatigue. Fatigue alone isn't diagnostic of cancer, but combined with other urinary symptoms, it's important not to ignore it. 9. Unexplained weight loss or appetite loss. Weight loss without dieting or noticeable changes in eating habits, especially when combined with other urinary or general symptoms, could signal advanced bladder cancer. Loss of appetite often accompanies fatigue and weight loss. 10. Swelling in feet or legs. More common in advanced stages. Unexplained swelling, edema in the legs, ankles, or feet can occasionally appear early due to impaired kidney function from bladder tumors blocking urine flow. What should you do if you notice these signs? Don't panic. Early symptoms can be related to various conditions besides cancer, but never dismiss persistent or recurring symptoms. Make a note of your symptoms, document their frequency, duration, and severity. Include any related details, like color of urine or specific sensations. Schedule an appointment with your primary care doctor or urologist immediately. Use clear language to explain your concerns, such as, "I've noticed blood in my urine twice in the past week. I'd like to check if it's something serious." Remember, recognizing and acting upon these early symptoms significantly increases the chance of successful treatment and full recovery. In the next part of this video, we'll explain risk factors you need to be aware of, helping you understand whether you're more likely to develop bladder cancer and why regular screenings may be critical. Understanding the factors that increase your risk of bladder cancer can help you take proactive steps toward early detection and prevention. While anyone can develop bladder cancer, certain individuals are at significantly higher risk. Here are the key risk factors you should be aware of. 1. Smoking and tobacco use. Smoking is the single largest risk factor for bladder cancer. Smokers are at least 3 times more likely to develop bladder cancer than non-smokers. Harmful chemicals from tobacco smoke pass through your kidneys and accumulate in your urine, directly damaging the bladder lining. Even if you smoked decades ago, your risk remains elevated, making regular screenings especially important for current and former smokers. 2. Age risk of bladder cancer increases as you get older. Most cases are diagnosed in people over age 55. While bladder cancer can occur at any age, it's relatively uncommon in younger individuals. Regular checkups, especially after age 50, can greatly increase the likelihood of catching bladder cancer early. 3. Gender bladder cancer is more common in men than in women, approximately 3 to 4 times more likely. However, women often have a worse prognosis because symptoms can easily be mistaken for common infections or other gynecologic issues, delaying proper diagnosis. 4. Exposure to chemicals. Long-term exposure to certain industrial chemicals significantly increases the risk of bladder cancer. Workers in industries such as chemical manufacturing, rubber, textiles, dyes, printing, painting, and petroleum are at higher risk. Hairdressers and truck drivers, who frequently encounter exhaust fumes and hair dyes, also face elevated risks. 5. Chronic bladder inflammation and infections. Recurrent urinary tract infections (UTIs). Chronic bladder inflammation, or prolonged use of catheters, can increase your risk. Chronic irritation of the bladder lining may promote cancerous changes over time, so effective treatment and monitoring of bladder infections and inflammation are essential. 6. Personal or family history of bladder cancer. If you previously had bladder cancer, your chance of recurrence is higher. A family history of bladder cancer, though less common, can also elevate your risk. Genetic factors and hereditary predispositions may play a role, so knowing your family medical history can help inform your screening schedule. 7. Certain medications and supplements. Long-term use of certain medications, such as the diabetes drug pioglitazone actose, has been associated with an increased risk of bladder cancer. Dietary supplements containing ristolochic acid, often found in herbal supplements used for weight loss or other purposes, have also been linked to higher bladder cancer risk. 8. Dehydration and infrequent urination. People who do not drink enough fluids and urinate infrequently may have an increased risk. Urinating regularly helps flush potential carcinogens out of the bladder. Staying adequately hydrated helps keep your bladder healthy. 9. Radiation therapy. Previous radiation therapy to the pelvic region for prostate, ovarian, or cervical cancers, for example, can increase your long-term risk of developing bladder cancer. 10. Dietary factors. Diets high in fried meats, processed foods, and saturated fats may slightly increase bladder cancer risk. Conversely, diets rich in fruits, vegetables, antioxidants, and adequate hydration may reduce your overall cancer risk. Why knowing your risk matters. Understanding these risk factors allows you to be proactive. If you identify multiple risk factors in your life, you should discuss regular bladder cancer screening with your healthcare provider. Early screening may include simple urine tests, imaging scans, or cystoscopy, especially if you have multiple or strong risk factors. Making lifestyle changes, such as quitting smoking, reducing exposure to harmful chemicals, and maintaining a healthy diet, can significantly lower your risk. In the next section, we'll explain how to stay calm, informed, and take appropriate action if you think you might be experiencing symptoms or fall into one of these higher-risk groups. Finding out that your symptoms match some of the early warning signs of bladder cancer or realizing you fall into one of the higher-risk categories can understandably trigger anxiety or worry. But remember, early recognition of these signs gives you a powerful advantage, the opportunity to act proactively, calmly, and clearly. Here's exactly how to respond effectively, without panic or fear. Step 1. Take a deep breath. Stay calm. Experiencing symptoms or discovering you're at higher risk doesn't mean you definitely have cancer. Many symptoms can result from conditions far less serious. Panic won't help. Staying calm will empower you to take logical, effective action steps. Step 2. Record your symptoms clearly before you see a healthcare provider. Take a few moments to write down exactly what symptoms you're experiencing, e.g., blood in urine, frequent urination, pain, when each symptom started, how often and how long they last, any patterns or triggers you've noticed, e.g., after certain activities, foods, or times of day, any recent health changes or lifestyle factors you think might be relevant. Having clear notes will help your doctor diagnose more quickly and accurately. Step 3. Make an appointment immediately. Like out to your primary care physician or, ideally, a urologist who specializes in urinary tract health. Clearly communicate your concerns. For instance, say something simple but direct like, "I've noticed blood in my urine and frequent urination over the past few weeks. I'd like to rule out anything serious like bladder cancer." Be firm and advocate for yourself if needed. Your peace of mind and health are priorities, and early action can dramatically improve your outcome. Step 4. Prepare for your appointment. At your visit, be ready to clearly describe your symptoms using your notes. Mention any known risk factors, e.g., smoking history, chemical exposure, previous cancer history, family medical history. Ask straightforward questions, such as, what tests will I need? What exactly will each test tell us? If something abnormal is found, what's the next step? Step 5. Understand possible tests clearly. Your doctor will likely suggest straightforward, painless, and quick initial tests such as urinalysis to detect blood, infection, or abnormal cells in your urine. Urine cytology, examining your urine under a microscope to look for abnormal or cancerous cells. Ultrasound or CT scan, imaging studies that give detailed pictures of your bladder. Cystoscopy, a minimally invasive procedure where a thin, flexible camera gently examines the inside of your bladder for tumors or abnormalities. Each test is quick and provides valuable information for accurate diagnosis. Step 6. Trust your medical team. Specialists like urologists are highly trained and experienced in diagnosing and treating bladder issues, including cancer. Trust their guidance, but don't hesitate to ask questions or seek second opinions if you're uncertain or want additional reassurance. Step 7. Take one step at a time. If the initial tests come back clear, fantastic, you've gained peace of mind and valuable baseline health information. If cancer is identified, remember, early-stage bladder cancer is very treatable. Stay calm, ask questions, and follow your medical team's advice closely. Step 8. Seek support and stay positive. Share your concerns and progress with trusted family and friends. Consider joining support groups or communities if needed. You're not alone. Many have successfully faced and overcome similar situations. Step 9. Focus on prevention and follow up regardless of your diagnosis. This is an ideal time to reduce risk factors, improve your diet, quit smoking if applicable, and commit to regular medical checkups. Your proactive attitude toward your health can make a life-changing difference. Step 10. Maintain a positive mindset. Your mindset matters. Early detection is empowering, not alarming. You're taking the best possible action for your health by being informed and proactive. Positivity, clear information, and timely action provide the strongest path forward. By calmly taking these clear steps, you dramatically increase your chances of identifying bladder cancer early when it's highly treatable and outcomes are excellent. In the next part, we'll dive deeper into the specifics of diagnostic tests, explaining exactly how each test works and what you can expect, making the entire process less intimidating and more understandable. When you visit your doctor with symptoms that might indicate bladder cancer, they'll likely recommend a series of diagnostic tests. These tests might sound intimidating, but they're straightforward, typically painless, and essential for giving you clear answers. Here's exactly what each test involves and what you can expect. 1. Urinalysis. Urine test purpose: identifies blood, infection, or unusual substances in your urine. Procedure: you simply provide a urine sample in a small, sterile cup. The lab quickly analyzes your sample to detect blood, infections, and other abnormalities. What it means: a positive test, e.g., blood detected, doesn't automatically mean cancer, but it will prompt further testing. 2. Urine cytology purpose: checks your urine for abnormal cells that might indicate cancer or precancerous conditions. Procedure: again, just a simple urine sample in a sterile container collected at your doctor's office. The sample is examined under a microscope by a specialized pathologist. What it means: abnormal cells could indicate bladder cancer or other urinary tract issues. This usually leads to additional evaluation. 3. Imaging tests: ultrasound, CT scan, MRI purpose. Imaging tests allow doctors to visualize your bladder and surrounding structures clearly, identifying possible tumors, abnormalities, or signs of cancer spread. Procedures: ultrasound: a technician gently moves a small probe across your abdomen. This is quick, painless, and completely non-invasive. CT scan: you lie on a table that moves into a donut-shaped scanner. A special contrast dye given through and for or orally can enhance image clarity. It takes only minutes, is painless, and provides detailed images. MRI: similar to CT scans but uses magnetic fields and radio waves. MRI offers highly detailed images and is especially useful in special cases. It's also painless but may take slightly longer. What it means: these images help identify tumors, their size, shape, and if cancer might have spread. 4. Cystoscopy bladder scope purpose: directly examines the inside of your bladder using a tiny camera. Allows doctors to clearly identify tumors or abnormalities and obtain tissue samples biopsy if needed. Procedure: typically performed by a urologist. A thin, flexible tube cystoscope with a tiny camera on the tip is gently inserted through your urinary opening and into your bladder. The bladder is gently filled with sterile water to provide a clear view. Usually takes less than 10 to 20 minutes, and you'll receive a local anesthetic or mild sedation to minimize any discomfort. What it means: this test offers the most definitive evaluation for bladder tumors or other structural abnormalities. If suspicious areas are found, small tissue samples biopsies may be taken immediately. 5. Bladder biopsy purpose. Confirms whether abnormal areas detected during cystoscopy are cancerous. Procedure. Usually done during cystoscopy. Tiny samples of bladder tissue are taken and sent to a pathology lab for careful microscopic examination. Painless during the procedure due to local anesthetics or mild sedation. Minimal discomfort afterward. What it means: biopsy results definitively determine whether bladder cancer is present, and, if so, how aggressive it is. 6. Additional blood tests purpose. Evaluates your overall health and detects signs of cancer or its impact on organ function. Procedure. A small blood sample taken from your arm at your doctor's office or lab. Blood counts, liver and kidney function tests, and other indicators are assessed. What it means: helps doctors evaluate your general health status, cancer stage, and appropriate treatment options. What happens next? Once these tests are complete, your doctor will clearly discuss the results and their meaning with you. Together, you'll plan your next steps. If tests are clear, wonderful. Continue regular checkups and preventative lifestyle measures. If cancer is identified, early detection means you have an excellent chance for successful treatment and recovery. In the next part, we'll explore exactly what treatments are available when bladder cancer is detected early. You'll see that early-stage bladder cancer treatments are straightforward, highly effective, and generally allow for rapid recovery. When bladder cancer is detected early, you have an excellent chance for successful treatment, often with minimally invasive methods and shorter recovery times. Here's a clear breakdown of the most common and effective early-stage treatments, what to expect, and how they help you get back to your life as quickly as possible. 1. Transurethral resection of bladder tumor (TURBT). What is it? The most common initial treatment for early-stage bladder cancer. A minimally invasive procedure that removes tumors directly through the urethra, no external incisions needed. How it works: under anesthesia, usually general or spinal, the doctor uses a cystoscope with specialized surgical instruments to remove visible tumors or abnormal tissue. Often an outpatient procedure or brief hospital stay less than 24 hours. Recovery: mild discomfort or blood-tinged urine for a few days. Quick recovery: most people resume regular activities within 1 to 2 weeks. Effectiveness: highly effective for superficial, non-muscle invasive bladder cancer, often completely eliminating the cancerous tissue. 2. Intravesical therapy. What is it? Treatment involving medication placed directly into your bladder, usually after a TURBT procedure. Common medications include Bacillus calmette-guerin (BCG), chemotherapy drugs such as mitomycin C, or newer immunotherapies. How it works: medication is introduced into the bladder through a catheter. You hold the medication in your bladder for about 1 to 2 hours, allowing it to directly target cancer cells. Then urinate normally. Recovery: typically minimal side effects, mild irritation or burning sensation during urination, usually given weekly for about 6 to 8 weeks, then periodically afterward. Effectiveness: significantly reduces recurrence risk. Very effective for superficial bladder cancers, preventing progression to invasive stages. 3. Follow-up surveillance. Regular checkups. What is it? Regular cystoscopy examinations and urine cytology tests every 3 to 6 months initially, then annually if stable. How it works: early bladder cancer can recur. Surveillance helps detect and treat recurrences swiftly and effectively. Quick, minimally invasive checkups with cystoscopy, often performed in your doctor's office. Recovery: little to no discomfort, no downtime afterward. Effectiveness: critical in catching and managing recurrences at their earliest stages, maintaining excellent long-term prognosis. 4. Laser therapy. What is it? Uses focused laser energy to destroy small cancerous lesions or superficial tumors inside the bladder. How it works: a thin laser fiber is guided through the cystoscope to precisely remove or destroy cancerous cells. Recovery: similar to TURBT, minimal discomfort, quick return to normal activities within a few days. Effectiveness: ideal for very small, superficial tumors, often used in conjunction with TURBT or intravesical therapy for maximum benefit. 5. Lifestyle and nutritional support. What is it? Adjustments to diet, hydration, and lifestyle habits to support overall bladder health and healing. How it works: staying hydrated, avoiding bladder irritants like caffeine, alcohol, and spicy foods, and adopting a balanced diet rich in fruits, vegetables, and whole grains. Smoking cessation significantly reduces recurrence risks. Effectiveness: enhances your body's natural defenses, supports faster recovery and reduces risk of recurrence if bladder cancer is slightly more advanced yet still early. Sometimes, bladder cancer detected early has started to invade deeper layers, requiring slightly more aggressive treatment, partial cystectomy, surgical removal of just the cancerous part of the bladder, preserving bladder function, radical cystectomy, removal of the entire bladder, typically accompanied by reconstructive procedures, usually considered only if the cancer is more aggressive or not responsive to less invasive therapies. Note, such advanced interventions remain highly successful when caught at an early invasive stage, underscoring the value of early detection. The bottom line on early stage treatment: when bladder cancer is caught early, your treatment is less invasive, recovery is faster, and your long-term outlook is excellent. You can maintain a normal, active lifestyle with minimal disruption. But to maintain these benefits, regular follow-up care and healthy lifestyle habits are key. In the next part, we'll explore straightforward lifestyle changes that can dramatically reduce your risk of bladder cancer recurrence and enhance your overall health. Now that you understand the importance of detecting bladder cancer early and the effective treatments available, let's talk about something equally important: how you can actively lower your risk of bladder cancer and help prevent it from developing or recurring. The good news? Small changes in your everyday habits can make a big difference. Here's how you can significantly reduce your bladder cancer risk through straightforward lifestyle adjustments. 1. Quit smoking immediately. It matters. Smoking is the single greatest risk factor for bladder cancer. Quitting can dramatically reduce your risk, even if you've smoked for many years. How to do it? Seek support through smoking cessation programs or your healthcare provider. Consider FDA-approved medications, nicotine replacements, or counseling programs that greatly increase your chances of quitting successfully. 2. Drink plenty of water. It matters. Staying well hydrated flushes harmful toxins from your bladder quickly, reducing prolonged exposure to potential carcinogens. Diluting urine helps prevent irritation and inflammation of your bladder lining. How to do it? Aim for at least 8 glasses, about 2 liters of water daily. Limit beverages like soda, coffee, tea, or alcohol, as they may irritate the bladder. 3. Maintain a healthy diet. It matters. Diets high in fruits, vegetables, whole grains, and lean proteins provide essential antioxidants that protect your bladder cells. Processed meats, excessive red meat, and fried foods contain substances linked to increased bladder cancer risk. How to do it? Incorporate colorful fruits and veggies, berries, broccoli, spinach, carrots into each meal. Limit intake of processed and fried foods. Choose lean meats, fish, or plant-based protein sources. 4. Limit exposure to chemicals. It matters. Exposure to industrial chemicals, dyes, solvents, and other workplace hazards increases bladder cancer risk. How to do it? Always wear protective gear, gloves, masks, clothing if working around industrial chemicals. Follow workplace safety protocols closely. At home, choose non-toxic cleaning supplies and reduce unnecessary chemical exposure. 5. Regular exercise. It matters. Regular physical activity boosts your immune system, reduces inflammation, and decreases overall cancer risk. Helps maintain a healthy body weight, another key factor in reducing cancer risk. How to do it? Aim for at least 30 minutes of moderate exercise daily: walking, cycling, swimming, yoga. Find activities you enjoy. Consistency is more important than intensity. 6. Regular bladder emptying. It matters. Holding urine too long increases bladder irritation and exposure to harmful substances. Regular urination flushes out potential carcinogens. How to do it? Don't wait excessively to urinate. Try to empty your bladder every 3 to 4 hours. Ensure you fully empty your bladder to prevent stagnation and irritation. 7. Maintain a healthy weight. It matters. Being overweight or obese increases inflammation and hormonal changes that can elevate cancer risk. A healthy weight lowers bladder cancer risk and improves your overall health. How to do it? Combine balanced eating habits with regular exercise. Set realistic weight loss goals with guidance from healthcare professionals. 8. Regular health checkups and screening. It matters. Early detection is vital. Regular screenings catch potential issues before they develop into serious conditions. Frequent checkups ensure any recurrence or new health issues are quickly spotted and addressed. How to do it? Schedule annual physical exams with your primary care physician. Discuss appropriate bladder cancer screenings with your healthcare provider, especially if you have risk factors. 9. Limit alcohol consumption. It matters. Alcohol, especially when consumed excessively, may increase bladder irritation and cancer risk. How to do it? If you drink alcohol, limit intake to moderate amounts, up to 1 drink per day for women, 2 for men. Incorporate alcohol-free days each week to reduce bladder irritation. 10. Know your family and personal health history. Why it matters. Genetics can influence your bladder cancer risk. Awareness allows for proactive prevention. How to do it. Discuss your family's cancer history with relatives and document it clearly. Share this information with your healthcare provider to assess if additional screenings or precautions are needed. Putting it all together. Adopting these lifestyle changes not only significantly reduces your bladder cancer risk but enhances your overall health and quality of life. Prevention is powerful. Taking control of these simple daily habits can dramatically impact your future. Remember, the best medicine is always prevention. Your health and well-being deserve your attention, care, and consistent action. You have the power to choose a healthier future today. In the next part of this video, we'll provide a powerful, motivational summary reminding you of your ability to control your health and the importance of proactive care. Let's take a moment to reflect. You've just learned the early signs of bladder cancer. You now understand the risk factors, the steps to take when symptoms appear, the diagnostic process, and the powerful treatments available when caught early. More importantly, you've discovered how everyday habits, what you eat, drink, breathe, and do can shape your future. Now, here's the most important truth. You have more control than you think. Bladder cancer doesn't usually scream for attention. It whispers. But when you know how to listen, when you recognize the subtle signs, understand your risks, and act without fear, you shift the odds in your favor. Don't wait for a wake-up call. Too many people ignore symptoms, delay checkups, or convince themselves that it's nothing. That delay could cost months or years of health and life. But not you. You're here, you're informed, and that means you're already steps ahead. You are not alone if you're worried. Remember, thousands of people are facing the same questions, the same concerns, and the same fears. But they're also finding answers, getting help, and beating bladder cancer every single day. With early detection, 5-year survival rates for non-invasive bladder cancer exceed 95%. That's not just a statistic. That's real hope, backed by real science, proven by real people just like you. Be your own advocate. No one knows your body like you do. If something doesn't feel right, trust your instincts and speak up. Whether it's blood in your urine, changes in how often you go, or just a persistent sense that something's off, get checked. Ask questions, push for answers, make prevention a daily practice. That prevention isn't about fear, it's about freedom. Freedom to live life fully, freedom from regret, freedom to age gracefully and healthfully. Drink more water, eat cleaner, breathe deeper, move your body, sleep well, quit smoking, get screened, laugh often. Surround yourself with people who support your well-being. These choices are simple, but their impact is profound. Share what you've learned. Someone you love right now might be ignoring the same signs you just learned about. Be the one who opens that conversation. Be the voice that makes a difference. Early detection doesn't just save lives, it saves futures, families, moments. Your health is worth fighting for. You are not powerless. Every decision you make is a vote for your future. So choose to be informed. Choose to act early. Choose to live fully. You've already taken the first step by watching this video. Now take the next one. Call your doctor, schedule a checkup, or talk to someone who needs this information. The path to health starts with awareness. The journey continues with action, and it's never too late to begin. Stay strong, stay proactive, and stay in control because your health is in your hands. If this video helped you, don't forget to like, share, and subscribe. It might just save someone else's life too. Turn on notifications so you never miss future health guides and early detection tips from our expert team. Thank you for watching. Take care of yourself, you're worth it.